Hi, yes, I'm calling because I'm supposed to get a cervical cerclage done around week 14, and I recently had like a little scare. So I was just wondering if there was any way we could move it up. Maybe something opened up in my specialist schedule. Your name's Miranda Riley, right? We were actually gonna call you. Oh, you were gonna call with an opening? No, unfortunately, the specialist had a family emergency, so he's gonna have to push back your cerclage date to around week 16. He told me to call you and let you know. Okay, I'm sorry to hear that, but at the same time, I was supposed to get this done at week 12, and we're kind of pushing it because the pregnancy where I was deemed to have incompetent cervix 19-20 weeks. So I'm cutting it very close to when things happened last time. I'm aware. I'm looking at your pregnancy chart right now. But the specialist did say that, you know, there's some wiggle room, and it's probably okay to push it back just 2 more weeks. And he says that it should be okay. Okay, he may say that it's fine, but I'm still the one that has to like sleep at night. And I have my baby in my belly, so I'm really. Is there anyone else that could possibly do this surgery? You know, anyone else in the office that could? No, I mean we do have one other doctor, but he's out of town, and I don't think he would come back for something like that. May I ask why this wasn't scheduled earlier in your pregnancy? Usually, the cerclage is scheduled very early on, and I heard that you scheduled yours a little later. Yeah, I started this whole thing late because I didn't realize I was pregnant until I was 9 weeks. I didn't know that I was pregnant. If I had, I would have scheduled this way in advance. Oh, I'm really sorry to hear that. As far as getting this done sooner, I could recommend you another specialist or another OBGYN that can do the procedure for you, but it would be out of state, so I don't really know if that's accommodating for you, and I don't know what their schedule would look like. You can give me the information, but there's really nothing I can do in terms of like at least keeping the cerclage on schedule. I don't forget about having it earlier. There's no way that we can just keep my. No, I wish I could help, but you know, there's really not much we can do with his situation. If he could do it, he could do it, but it seems like he's going to be out for the next 2 weeks. Okay, thank you. Oh.